years ago I had a knee replacement and I fell, and they had to go back in and do a second surgery to find that I got an infection. Due to the fact that I'm going back in for surgery, I am in a lot of pain. I've been at the Claremont a couple weeks now preparing for my last surgery, hopefully, on a knee replacement. And since I've been here, they have used a unique technique for therapy on me to manage pain. They have a procedure that they do with tape. It's put on the leg or the point of pain where you have your pain. And whatever is done, it totally eliminates it. It eliminates the swelling. After a day or two, the pain is completely gone. And it's worked for me.
The Claremont, we specialize in short-term therapy and rehab, and also have a handful of residents who live here. This is their home. I would say about probably 50 to 60% of the patients that we have here, whether they live here or they're here for short-term rehab, have some type of pain.
The quality of a patient or resident's life is affected by pain because pain is going to limit anything that they're going to want to do, things that they're able to do. There's always going to be that limitation of pain. So until you break the pain cycle and decrease the pain so they can get back to their daily routine, back to work, back home, we're not going to be doing our job.
I fell in the store. I don't want to mention the store, but I fell in the store and I landed on my back and it just about knocked me out. They took me Northwest Hospital. When I came here, I had terrible pain in my back. I have a compressed fracture of my back. And since I got to the Claremont and since they've been doing these various types of therapy, it's working out quite well for me.
Ruben he's in his 90s, which you would never guess. He has chronic back pain due to spinal stenosis, and one of the treatments that we do with him is interferential current, which is just deep electrical stimulation into his back to help alleviate his pain, and hopefully we'll get his pain under control and return him home.
I'm very, very grateful for all the help that Claremont has given me, and I feel that I'm going to walk out of here in good shape.
When most people think of pain management, they think of medications. And medications are fine, but they're not good enough alone. So from the therapy department at the Claremont, we offer a variety of different options for patients, and they're individualized depending on the patient's needs. We use everything from modalities such as electrical stimulation, shortwave diathermy. We use kinesiotaping, which is very innovative and used all the time on the Olympics.
Another treatment we're using is ultrasound, which has been used with Helen. She has a broken ankle, but because of her previous injury to the wrist, she's not able to ambulate using her arms and pushing on the walker. We're using the ultrasound to decrease swelling, increase circulation, to improve mobility and stabilize the joint.
Our goal at the Claremont is to have our patients leave as pain-free as possible and return to a productive, happy life.